Welcome to 5MOL, your 5 minutes of learning. Today we're diving into a crucial topic, understanding the different types of feeding tubes. Our goal? To simplify complex clinical tasks, boost your learning, and get your valuable feedback to make our content even better. After this session, please hit that feedback link, go to Learn Something New Today, and share your biggest takeaway to help spread this essential knowledge. So, what exactly is tube feeding? Every patient has unique nutritional needs, especially with complex health challenges. When conventional eating isn't possible, supplementary feeding becomes vital, whether it's a temporary solution or a long-term necessity. The type of feeding tube and how it's administered depends on so many factors: a patient's weight, height, activity level, medical condition, and even their home environment. Plus, we always consider their ability to eat or drink anything on their own. There's a wide array of options to meet specific dietary needs, from low or high energy requirements to those needing extra fiber, high protein, or managing lactose intolerance. Your dietitian is key here, ensuring optimal nutrition and care. NICE guidelines categorize feeding tubes by their expected duration and route. For short-term needs, we often see nasal tubes. Think nasogastric or NG tubes going straight to the stomach, super common. Then there's nasoduodenal or ND reaching the duodenum, and NJejunal extending further into the jejunum, especially if stomach feeding isn't tolerated due to vomiting or aspiration risk. For long-term solutions, we move to surgically placed tubes. Gastrostomy, known as a G-tube or PEG, goes directly into the stomach. Jejunostomy, or J-tube, bypasses the stomach entirely, going straight to the jejunum. And sometimes a gastrojejunostomy, or GJ-tube, offers the best of both worlds, allowing feeding into the intestine while also venting the stomach. Beyond the tube type, how do we deliver the feed? Quick questions for you to consider. What's the real difference between a PEG and a J-tube? Why might a patient need both a PEG and a J-tube in one device? And how do you decide which tube to use for feeds versus medications? Remember, always practice within your scope of competence. If you're ever in doubt about a feeding plan or medication administration, always seek guidance from a clinical professional. Your patient's safety is paramount. For more details, check out the Royal Marsden Manual and NICE guidelines.